माँ सरस्वती का ये जो नवरात्रि का जो पर्व चल रहा है उसमें हम एक नया ज्ञान यज्ञ शुरू करने जा रहे हैं। तो सर्वप्रथम माँ सरस्वती को नमन करते हुए सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारंभम करिष्यामि सिद्धिर्भवतु मे सदा। ओम नमो भगवते वासुदेवाय धन्वंतरे अमृत कलश हस्ताय सर्वामय विनाशाय त्रैलोक्यनाथाय महाविष्णवे नमः। O Lord Dhanvantari, please shine something upon us so that we can reflect the world. So dear friends, the topic which we are going to discuss today in brief is regarding, yes, Ayurvedic Urology. Super specialized practice in Ayurveda with special context to urology. आयुर्वेद, वैसे देखें तो हमें आयुर्वेद आज के युग में अधिकतर लोगों को आयुर्वेद जानना पड़ता है, समझाना पड़ता है। वास्तव ये था कि ब्रिटिश इन्वेजन के पहले आयुर्वेद was the only system of healthcare and it was part of day-to-day life of each and every Indian. So what exactly happened? That we need to understand Ayurveda, we need to explain Ayurveda to each and everybody. The reason behind this is again very specific. Lord Macaulay's address to British Parliament dated 2nd Feb 1835. The way he says, I have traveled across the length and breadth of this country, means India, and I have not seen one person who is a beggar, one person who is a thief. Such wealth I have seen in this country, such high moral values, people of such caliber that I do not think we would ever conquer this country unless we break the very backbone of this nation, which is her spiritual and cultural heritage. And therefore, I propose that we replace her old and ancient education system, her culture, for if the Indians think that all that is foreign and English is good and greater than their own, they will lose their self-esteem, their native culture, and they will become what we want them, a truly dominated nation. So, in brief, unfortunately, he succeeded in his wish, and this is what we are paying for till date. Like, all that is foreign and English is good and greater than their own. That's why we need to explain Ayurveda to everybody. Like where we were before British invasion, there are certain examples. I'm just taking this preface to come to our basic topic regarding the super specialization or Ayurveda. Where we were definitely highly super specialized. Just take an example of this. Like in most of the schools, even today, it is taught that India was discovered by the Vasco da Gama in almost 15th century. अगर आप में से किसी ने जो आद्य ज्योतिर्लिंग है सोमनाथ का गुजरात का, वहां अगर कोई गए हैं तो उस मंदिर के पीछे एक बाण स्तंभ है। उस बाण स्तंभ पे एक श्लोक छपा हुआ है, उस पे लिखा है आ समुद्रांत दक्षिण ध्रुव पर्यंत अबाधित ज्योतिर्मार्ग। उसका अर्थ है कि इस बाण की दिशा में अगर कोई जाए तो दक्षिण ध्रुव तक बीच में कोई भी जमीन नहीं आएगी। तो हमें, और ये जो बाण स्तंभ बना है वो 7th सेंचुरी में बना है, और हमें पढ़ाया जाता है कि भारत की खोज किसने की, वास्को द गामा ने, वो भी 15वीं शताब्दी में। द फैक्ट इज इन 7th सेंचुरी वी वर अवेयर ऑफ साउथ पोल and the direction of South Pole. You must be knowing this, that everybody knows that who discovered aeroplane? Everybody says Wright brothers. Yes, Wright brothers, but it is exactly not right. The right thing is 8 years before the discovery of aeroplane by Wright brothers, Shivkar Bapuji Talpade, he did successful examination or flight of Marut Sakha airplane, which was designed by Shivkar Bapuji Talpade on the basis of Vedic knowledge. So we were that highly specialized before British invasion. So regarding Ayurveda, obviously, it is very important to know that even today, everybody knows that the most advanced branch of surgery, which is supposed to be the plastic surgery, is obviously originated by Maharshi Sushruta. And these facts were purposely kept covered since years from us to say that Indians are backward, but actually we were very highly specialized in each and every field of knowledge. And one of the most bright Example of this is Nalanda University, which was started in 427 and was running successfully up to 1197 for more than 8 decades, which was founded by Kumar Gupta dynasty. And obviously, the Ayurveda department in that university was again very well flourished. It is a long story that how it is destroyed by Bakhtiyar Khilji. Regarding this, we'll discuss later, but this is the history. So everything was highly specialized. The knowledge was at its peak in each and every section, in each and every department. So that was the super specialization. Regarding this, unfortunately, as long as the yoga and Ayurveda was yoga and Ayurveda, nobody was accepting it. And with time, when these two things traveled to the West especially, and when they came back with the stamp of scientific word, when they came back as yoga and Ayurveda, everybody is following them. So this is like something which need to be thought over again. That yoga is yoga, Ayurveda is Ayurveda. It's not yoga or Ayurveda. Now regarding the science, like everybody thinks that everything which is coming from the West is scientific. And which is there in our culture is not scientific at all. So regarding this, obviously our basic sciences, Ved, have defined the science. So what is science? Which is based on certain principles is called as science. जो सिद्धांतों पर आधारित है वही शास्त्र है. So obviously they have to define the siddhant or principle as well. So what is siddhant? A siddhant is a thing which is irrefutable in all times, means trikal abadit satya, which remains irrefutable in all times. So let us take an example regarding so-called such modern sciences, like modern dietetics. An example. In Western world, they publish a food pyramid every single year. It is a pyramid-shaped diagram. There are sections of it, and they say that one must consume this much amount of grains or fruits, vegetables, proteins, etc., etc. And they publish it every single year. And every single year they say that this is the most revised edition of food pyramid. Most advanced, most modern. Now this is what is changing every single year. This is exactly against the principle which should remain irrefutable in all times. Now come back to Ayurveda. Have you ever thought of this tadka? It is basically a food processing. Now, if you see the process, you must be aware of this thing that this particular tadka, this processing of food is only existing in India or Indian subcontinent. ये केवल भारत का है, भारत के बाहर कहीं पे भी नहीं है. Now, this is very specific that the way it is processed. पहले तेल गरम होगा, उसके बाद ही उसमें राई डलेगी, बाद में क्रम से चीजें आती है. Now, if you try to find the origin of this तड़का, आप अगर पूछेंगे घर में तो मम्मी को पूछेंगे तो उनकी मम्मी से सीखा, उन्होंने उनकी मम्मी से सीखा, उन्होंने उनकी मम्मी से सीखा, ऐसे पीछे 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 कितना भी जाएंगे तो भी आपको इसका ओरिजिन नहीं मिलेगा. But the process has remained unchanged for years. This is basic food processing from Ayurveda. इसका ओरिजिन आयुर्वेद से है. जो कृतयुष कहते हैं वही है ये. अब ये किस लिए है? Why to process food? Two basic reasons. One, to make it tasty. Second, to make it easy to digest. And that's why now the whole world is accepting that typically Indian food is the most tasty and very healthy food. ये होता है फर्क शास्त्र में. ये है आयुर्वेद का आहार शास्त्र और वो था आधुनिक आहार शास्त्र. तो दोनों में अंतर समझ पा रहे हैं कि हम कहाँ थे और कहाँ पहुंच रहे हैं अभी ये सब के चलते. तो आज पूरी दुनिया मान रही है कि the typical Indian thali is supposed to be the complete food, healthy food. And in like many day boarding schools in UK, United Kingdom, they are serving typical Indian thali to their wards since many years. This is the fact. So again, going back to our culture, going back to that super specialization, that specialty, that peak of knowledge, we need to be really very determined. So arise, awake, and stop not until the goal is reached. And more than that, the way Swami Vivekananda ji says, when we have to learn, obviously we have to learn. And that's why this famous quotation is there that nobody in this world is ever been taught. Everybody has to teach herself or himself. So get ready, to this journey. And to learn, especially in the field of medicine, is very important that there are three different verbs. These are to see, like while traveling by a train or a car, we just see outside. The things are going, trees, fields, villages. We are just seeing that. But we never see a movie. We always watch a movie. So whenever we watch a movie, obviously it is with full concentration. But while watching that movie, most of the time we flow with the stream of that scene or emotions. The next word is very important, to observe. It is critical analysis. So whenever we are observing, yes, it is without the feelings. So this is very important, that in our field, observation is the most important part. Just let me explain with this particular concept with an example. Class of pathology. It was actually the first lecture of pathology going on. The head of the department came on in, and he said that obviously if we need to observe many things like sputum, vomitus, stools, urine, obviously we need to observe it without emotion. So there is no place for emotions in a pathology lab. So you have to keep your emotions outside while entering a pathology lab. So for that, there is a training mechanism. I'll explain you. He goes outside, comes back with a dish. There is cow dung in that dish. And he says, now everybody has to follow me to get out of the emotions, to overcome your emotions, because without overcoming the emotions, you will not be able to observe the things properly. So what he does, he put his finger into the cow dung and put it in his mouth. And now he said that everybody has to do that. Now everybody was doing that one by one with like different faces. Everybody was like, personally, HOD is doing this, so we have to do this. And ultimately everybody did that, and everybody sat on their seats. And then he said, look dear, the most important thing is the observation. I put my index finger in the cow dung and put my middle finger in the mouth, which you lost, which you didn't observe. So observation is very important. So to study, again, the next step is, obviously the field of medicine is just like the field of a detective. Obviously patient comes to us ultimately with the complete or the end result. So we need to go back. So regarding this, there is a famous story of an elephant and 5 blinds. जन्म से अंधे हैं 5 लोग, कभी जन्म में कुछ चीज देखी नहीं है. कुछ एक हाथी के बारे में स्टोरी सुनते हैं और उनको लगता है कि उनको हाथी देखना है. भूत सवार हो जाता है कि हाथी देखना है, कुछ भी हो जाए. तो लेके जाते हैं हाथी देखने के लिए. जैसे ही जू में पहुंचते हैं, उनको बोला जाता है 5 लोगों की, आप हाथी देख लो. सब अपनी अपनी तरह से हाथी देख रहे हैं. जिसने पूंछ को पकड़ा है, कोई उसके पैर को पकड़ा है, किसी ने उसकी ट्रंक को पकड़ा है, किसी ने कान को पकड़ा है, किसी ने पीठ को पकड़ा है. सबको वापस बुलाते हैं, पूछते हैं हाथी कैसा है. तो जिसने पूंछ को पकड़ा है बोलता है कि झाड़ू जैसा है. सूंड जिसने ट्रंक को पकड़ा है वो कहता है कि पाइप के जैसा. जिसने पैर को पकड़ा है खंबे के जैसा. जिसने पीठ को पकड़ा है दीवार के जैसा. जिसने कान को पकड़ा है कहता है सुपड़ी की जैसा है. अब इसमें से कोई भी गलत नहीं है और ना कोई सही है. यही है निदान पंचक. तो अगर हमें बहुत अच्छी तरह से कोई भी फील्ड में एक्सेल करना है, स्पेशली कोई भी सुपर स्पेशलाइज्ड फील्ड में अगर एक्सेल करना है, तो वी नीड टू अंडरस्टैंड दिस कंसेप्ट ऑफ निदान पंचक वेरी क्लियरली. अब इन 5 चीजों को जब हम जोड़ते हैं तो हाथी पूरा हो जाता है. यही है निदान पंचक और ये बहुत इंपॉर्टेंट है इन द फील्ड ऑफ मेडिसिन. सो रिगार्डिंग द सुपर स्पेशलाइजेशन, सब लोग डरते कि सुपर स्पेशलाइजेशन क्या होगा, कैसे होगा, ये तो बहुत कॉम्प्लिकेटेड होता है. तो एक इसी संदर्भ में एक छोटा सा एक स्टोरी है. एक बार क्या हुआ कि एक जीपी ने एक पेशेंट को एक सुपर स्पेशलिस्ट के पास भेज दिया. तो सुपर स्पेशलिस्ट के पास जाके आ गया, वापस आ गया. तो ये पेशेंट फिर से जीपी को मिलने गया. तो पूछता है कि उन्होंने क्या मतलब क्या हुई, मतलब मेरा क्या कंडीशन है. तो उन्होंने फोन किया सुपर स्पेशलिस्ट को, जीपी ने, और फिर बोलते हैं हाँ ठीक है. हाँ, उनकी बात चल रही थी फोन पे. फिर वो पेशेंट पूछता है कि क्या ऐसा, मतलब क्या है एग्जैक्टली, आपने उसके पास क्यों भेजा. तो बोलता है कि नहीं, वो जो भी समझा है उसने, जो भी डायग्नोसिस है वो सही है. वो मुझसे कंफर्म कर रहा था, एक सुपर स्पेशलिस्ट जीपी से कंफर्म कर रहा था कि ये सही है या गलत है. तो मैंने बोल दिया हाँ सही है। बोलते ऐसा क्यों? तो बोलते जब हम पढ़ाई करते हैं तो पढ़ाई करते हुए ऐसा होता है कि जो लोगों की बुद्धि कम होती है ना, उनको सुपर स्पेशलिटी में भी इतना ही छोटा सा ही काम करो उसके लिए भेज दिया जाता है। ऐसा कुछ जोक का पार्ट है ये, चलो छोड़िए। दूसरा है कि सुपर स्पेशलाइजेशन को हमेशा एक कॉम्प्लिकेटेड सब्जेक्ट की तरह देखा जाता है। वास्तव में ऐसा कभी नहीं होता है। जैसे क्या होता है कि एक मेडिकल कॉलेज था, उसमें वाइवा चल रहा था, तो वाइवा में एक स्पॉट वाइवा था, स्पॉट वाइवा में सब्जेक्ट रखा गया था एक बफेलो। अब वहां पे तीनों लेवल थे, ग्रेजुएशन का लेवल, स्पेशलाइजेशन और सुपर स्पेशलाइजेशन। तो जैसे ग्रेजुएशन के स्टूडेंट को बुलाया जाता है, पूछा जाता है ये क्या है, वो एकदम स्ट्रेट फॉरवर्ड उत्तर देता है कि दिस इज अ बफेलो। फिर स्पेशलाइजेशन का आता है स्टूडेंट, उसको पूछा था व्हाट इज दिस, द आंसर इज दिस इज अ फोर लेग्ड एनिमल विथ वन टेल, ब्लैक कलर्ड, मोस्टली अ बफेलो। फिर आता है टर्न सुपर स्पेशलाइजेशन के स्टूडेंट का, सेम स्पेसिमेन, सेम क्वेश्चन, द आंसर इज it is a four-legged animal with one tail, black color, sometimes gives milk, but the possibility of an atrophied elephant or a hypertrophied goat cannot be ruled out. तो ऐसे कुछ समझा जाता है, लोग इस तरह से कंफ्यूज होते हैं। बट व्हाट इज सुपर स्पेशलाइजेशन? कमिंग बैक टू आवर बेसिक टॉपिक, the process of becoming an expert in a very particular area of knowledge is super specialization. Expert in a very particular area of knowledge. Now why this is necessary? As far as Ayurveda is concerned, जब शास्त्रकार खुद अपने आप को क्या कहते हैं? अल्पमति। जिन्होंने शास्त्र बनाया वो लोग अपने आप को अल्पमति कहते हैं, तो हम तो कहाँ पे हैं सोचिए। And it is very well said that jack of all, master of none. In fact, this is the future of Ayurveda, that everybody has to choose a specific field and become an expert in that field. This is the need of the time. जिसे शास्त्रकार कहते हैं अल्पमति। फिर सुपर स्पेशलाइजेशन के लिए क्या क्या पॉसिबिलिटीज है? ऑब्वियसली ऑल द लूप होल्स वेयर द एग्जिस्टिंग कन्वेंशनल सिस्टम ऑफ मेडिसिन, दैट मींस एलोपैथी, हैज लिमिटेशंस। और उसके अलावा बहुत सारे स्कोप्स है, इंक्लूडिंग हेल्थ मेंटेनेंस, डिसीज ऑफ ट्रीटमेंट एटसेट्रा। नाउ regarding super specialization, there the possibilities are like in minimum words I can say that sky is the limit. Obviously there are two different areas, lifestyle oriented diseases and lifestyle consultation as well for health maintenance. The list is very long, including autoimmune diseases, metabolic syndrome, disease of respiratory tract, then disease of digestive and liver, digestion liver, disease of joints, bones, like locomotor system, disease of the skin, dermatology. This is one of the like very famous areas, constipation and hereditary diseases. This area is also very famous, and there are many super specialists in this field. They are practicing very like in a great way, and they have patients from, I would say, you must have heard the name of Dr. Mukul Patel sir. He was Vice Chancellor, Gujarat University. He is practicing in the field since almost 35 years, and he has patients from almost all the 7 continents of the world. This area is also very specific area where you can go for specialization. This area, psychological disorders. Now, regarding super specialization, obviously there are many challenges. Obviously there are scopes, but challenges as well. Regarding the challenges, obviously knowledge, the basic knowledge, there is no alternative for knowledge. You have to gain that knowledge by all means. The second part is expertise. In our field, theoretical knowledge has no value. It must be applied, that expertise. And once you get the experience, that gives you the confidence and yes, obviously the genuinity. कहा जाता है कि आयुर्वेद में अगर आपको सिद्धि पानी है, आयुर्वेद में सिद्धि बहुत महत्वपूर्ण है। सिद्धि, सफलता, यश, आपके चिकित्सा का यश। एंड यश तभी होगा जहां पे नीति है, जहां पे धर्म है। इसलिए ये पांचों चीजें हमारी दृष्टि से, जो हमारा जो भी जर्नी रहा है इतने वर्षों से, उसमें ये सब चीजें हम बहुत मानते हैं कि देयर इज नो अल्टरनेटिव फॉर बेसिक नॉलेज, then the expertise is very important, then the experience, then confidence, and ultimately the genuinity. And the most important along this is the confidence, because confidence is better than perfection, because perfection means doing the best, but confidence means knowing how to handle the worst, how to handle the complications. That's why the confidence is very important. Now, welcome to world's first and only Ayurvedic Urology Center, Brahma. Yes, dear. First is definitely our pride, but only is not at all our pride. There must be multiple Ayurvedic urology centers across the country. So we are struggling for that, and that's why we are going to start a very genuine basic course of Ayurvedic urology. So coming back to this, we are practicing in the field since almost 22 years. We are working in the field and we are managing all these conditions with Ayurvedic treatment, Mutragat, Mutrakucha. We can correlate these conditions with urethral stricture, benign enlargement of prostate, post-urethral walls, post-TRP status, bladder outlet obstruction, interstitial cystitis, recurrent and multi-drug resistant UTI, hypertonic bladder, neurogenic bladder, incontinence, etc., etc. Just to get the idea regarding urethral stricture disease, this disease, there is an abnormal narrowing inside the lumen of urethra. Obviously, that obstructs the flow of urine. Apparently, there are many symptoms, but the most important part is a person who is suffering with urethral stricture apparently looks absolutely normal, absolutely all right. But there is no personal life, no family life, no sexual life, no professional life. The whole life is very badly disturbed. And I have seen many patients, they literally try to commit suicide because of the disease. There are multiple modes of treatment for this disease as far as the conventional urology is concerned. But the thing is, it is officially written in the textbook of urology that once is a stricture, always is a stricture. So in other words, they have accepted the fact that there is no promising treatment in conventional or so-called modern urology for this disease. And the results of conventional urological treatment are not really very promising, and the treatment of stricture remains a challenge despite of those much advancements in so-called modern urology or conventional urology. So what we have to offer for this disease in urology, Ayurvedic urology? The treatments are Uttar Basti, calibration of urethra, oral medicines, that too only Ayurvedic medicines. Just let me show you the way we perform Uttar Basti at our institute. So the procedure of Uttar Basti, though it seems to be very simple, but there are certain important things that the procedure has to be conducted under very rigid aseptic precautions in absolutely sterile OT. Even the medicine should be properly sterilized. The most important thing is one should never ever introduce a catheter or a tube into urethra for the purpose of Uttar Basti. We use that small adapter to introduce the medicine. Generally, we introduce 16 of the medicine. Obviously, the whole medicine goes to the bladder and from there it works. Though the procedure seems to be very simple, very easy, but we have seen hundreds of aggressive vasovagal events while performing Uttar Basti, because urethra is supposed to be the most egoistic part of human body, and we are introducing something against the natural passage of urethra, which is from inside out, and we are introducing something exactly opposite to that. So obviously, while performing Uttar Basti has to be performed in a very well-equipped urology theater. There must be a multi-para monitor and all the necessary equipments and drugs to handle or to manage vasovagal event. In female also, we perform the same way. Actually, the video is not working in this laptop, but for female also, we do not introduce a catheter for the purpose of Uttar Basti. Now, it's a daycare procedure. It is painless. We have treated patients of age ranging from 5 years to 96 years within last 22 years. And nobody ever complained of pain. So it is painless. In most of the cases, I would say for maximum cases, it is bloodless. Very rarely we see little hemorrhage or hematuria after this, but it is bloodless. And patient can resume her or his daily routine immediately after the procedure, so no rest is required. So let me present like one case of urethral stricture. Now you know that in conventional urology, they believe that once is a stricture, always is a stricture. So this lady came to us from USA. This lady was suffering with typical urethral stricture since more than 12 years and has to undergo urethral dilatations every 6 months. Otherwise, she used to suffer complete retention of urine. So because of the fulminating urinary tract infection, she suffered complete retention of urine on 15th of October 12, when she approached nearest emergency in California. When the doctors were there, they tried to introduce different types of tubes into her urethra. Her urethra was not at all negotiable even with an infant feeding tube. So obviously, that lady has to go for the suprapubic catheterization as an emergency treatment to evacuate the bladder, the urine. Then after a series of investigations, she was ultimately advised to go for vaginal flap urethroplasty. When they actually posted the surgery on 23rd of January 13, when they tried to negotiate her urethra using a pediatric 10 French, which is the smallest cystoscope, they could introduce that scope for only 0.5 centimeter. Then they tried to negotiate urethra using a guide wire, which is thin like the lead of a lead pen. But even with that guide wire, her urethra was not at all negotiable distally. Then they introduced a flexible ureteroscope through that suprapubic approach, and they tried to negotiate urethra through the bladder. But even through that approach, her urethra was not at all negotiable, even with a guide wire. Obviously, they have to abort the procedure, and they explain that lady and her relatives that she has to lead rest of her life with this tube only. Now, for most of the people, once the doctors of US say that there is no hope, that means there is no hope at all. So what next? We have our website. The domain itself is cureurethrostricture.com. There is an online consultation form. People generally fill up the form. They attach reports and they share it with us. Then we respond to that. Obviously, for that lady, it was very hard to believe that an Indian doctor, that to an Ayurvedic doctor, says that it is curable. How come? And we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. And that's why we have many patients who are so-called modern consultants like physicians, surgeons, gynecologists, pediatricians. And I would say one of our patients, he himself is a urologist. We managed his stricture 8 years ago, and since then he's living absolutely normal life. So let me present this case first. So ultimately that lady came to us. We started her treatment on 20th of April 13. Within 10 days, we were able to remove her suprapubic tube with normal urine flow. A lady who was unable to pass even a single drop of urine, that lady passed with urine. This is the uroflowmetry report of that lady. That lady passed urine with max flow rate of 16.8 ml per second. We should be at least 15 ml per second. Average flow rate was 12.4, which should be at least 10 ml per second. This was without straining. So this is the beauty of this treatment, that her stricture opened up completely when the doctors of USA say that there is no hope at all. Not only this, but after completion of her treatment in May 13, she went back to USA. She came back after 3.5 years of this. When she came back, she especially came to see us. We did her follow-up uroflowmetry, and at that time her flow was fine. A lady who has to undergo dilatations every 6 months, her flow was absolutely fine even after 3.5 years. And now you can see that we treated her in April and May 13. This is September 25. So it's been more than 12 years that lady is leading absolutely normal life. So this particular case, and we have such hundreds of cases which disprove the belief, once is a stricture, always is a stricture. So we challenge that particular statement. Once is a stricture, always is stricture. This is absolutely not true. In Ayurveda, we have this promising treatment for this condition. We have such hundreds of cases. So this is the strength of Ayurveda. This is the strength of Ayurvedic urology. Now, this is very important, that it is very well said that Indians, they cannot or they do not perform well without pressure. We are like rockets. Unless until there is fire at back passage, we do not run. So it's very important that you can do wonders under pressure. That's why pressure is important. And in urology also, the pressure is very important. Now the next case, this is case of bladder outlet obstruction. Regarding urethral stricture. Urethral stricture is a structural obstruction. This bladder outlet obstruction or bladder neck obstruction is a functional obstruction. There is no as such structural obstruction. It is only a functional obstruction. The way Ayurveda says, Navegan dharet naudiret. Before that, Ayurveda says, Ayurvedopadesheshu videya paramadara. Then Navegan dharet naudiret. Now, what Vega dharan can exactly lead to this unique example how disastrous neglecting the urge of urine could lead a 9-year-old kid from Ahmedabad. This nowadays a very wrong or bad trend is getting viral everywhere, that if the washrooms or restrooms are unclean, one should not use such unclean restrooms. This kid must have heard the discussion somewhere, and he thought that the washrooms in his school are unclean. With that impression, he used to go to school by 7 a.m., used to come back by 3 p.m., and he used to hold urine for those much hours every single day for 2 years. And the result was, look at his bladder. Look at the size of his bladder. The way the sonologist mentioned, the bladder size was 1081 cc. For an adult, the bladder capacity is 4 to 500 ml. For a 9-year-old kid, it is 250 ml, max 300 ml. So just imagine his bladder was more than 4 times the normal, 1081 cc, that big. Just imagine a milk bag, 500 ml plus 500 ml, more than that. And the post-wide resting urine was 836 with significant back pressure changes on both sides, bilateral hydronephrosis, hydroureter. Sonologically, the diagnosis was neurogenic bladder. Radiologically, the diagnosis was this particular appearance of bladder is called as spinning top appearance in radiology. And the spinning top appearance is diagnostic of the posterior urethral walls, PUV. So radiological diagnosis was posterior urethral wall. And if you see here, denoted by the red arrow, cut off urethra, a very tight structure here. So the radiological diagnosis was posterior urethral walls and tight urethral structure. Sonologically, it was a case of neurogenic bladder. And that kid was advised to go for cystoscopy and VIU and PV fulguration as an emergency treatment to preserve kidneys. In fact, the way that family was explained by 2 urologists, one nephrologist, and one pediatric surgeon, that if you could perform the surgery today, then don't wait for tomorrow. Being a single kid of a very rich family, everybody was worried. Then they rushed to one of the most renowned Ayurvedic physicians of Gujarat state, Dr. Tapan Kumar Vaidya sir. And then he immediately referred that patient to me. Obviously, it was very challenging for me first to convince the family and then the kid. But fortunately, I could do that. We started the treatment, the same Uttar Basti, Panchakarma treatment. What Uttar Basti and Panchakarma can do, you can see in this example. So just after 8 days of the treatment, again, whenever you practice Ayurveda, the most important thing is it should be evidence-based. Without evidences, nobody will ever believe you. So we send the patient for follow-up ultrasound to the same sonologist. And here you can see, previously the bladder size was 1081. Now, just after 8 days, that size reduced to 460. Previously, the residue was 836, and now the residue is only 123, with significant improvement in back pressure changes. Literally, the sonologist called me to know, because he asked the patient, did you undergo any surgery? He said, no, I'm under Ayurvedic treatment. Where? Brahma Ayurvedic Urology Center. Then he literally called me, what exactly you did? I explained him, but he was unable to understand the thing. After 22 sittings of the treatment, the residue is only 4 ml with completely resolved back pressure changes. So this definitely Ayurvedic Urology can do without any major surgery. And not only this, but we have many such cases. So one of our patients, he's 10-year-old. We managed his his bladder outlet obstruction in August 23. It's been more than 2 years now. That kid is also leading absolutely normal life. His father is an interventional cardiologist. It was very challenging for us to convince him, but now he's leading absolutely normal life. So this is the strength of Ayurvedic urology. So in urology, it is believed that, in fact, more than 9 out of 10 urologists confirm passing urine saves your life. So one should never ever disrespect any natural urge, especially the urge for urine, mutra veg dharan. One should never ever do that. Why? Because passing urine saves your life. Always remember, passing urine saves your life. Never ever disrespect the natural instinct. Navigandharet naudireit. Next example. What Ayurvedic urology can do. Recurrent urinary tract infection or multi-drug resistant urinary tract. We regularly manage such cases. Just one example, one case. This guy came to us. He was suffering with typical UTI, with typical symptoms since 2 months. His daughter is a doctor, so obviously initially he was hospitalized because of the fulminating UTI. He was hospitalized for 15 days and was treated with parenteral or IV antibiotics. Followed by that, he was consuming oral antibiotics, and still there was no significant improvement. When he actually came to us on arrival, if you see, his body temperature was 104.3 degrees Fahrenheit. So we do take such challenges as well in Ayurvedic Urology at our institute. His blood pressure was 80/60, so he was typically in hypovolemia, hypovolemic shock, maybe septicemic. If you see the cultural sensitivity report, there were some antibiotics sensitive, but the antibiotics, like his condition was not at all responding to any antibiotic condition, any antibiotics. So the Ayurvedic treatment is bladder wash. Obviously, we do bladder wash using Panchavalkal cloth, which is fresh prepared and absolutely sterile. Uttar Basti with specific medicines and oral medicine, that too Ayurvedic medicines. Obviously, to manage hypovolemia, we secure the IV line. We stopped all his allopathy medicines and we started only Ayurvedic medicines, that to Rakta Medopachak. Rakta Medopachak, Rakta Pachak, 5 drugs. Patrol Sariva Musta Patha Katuki, Medopachak, 4 drugs, Kiratiktam, Amruta, Chandanam, Vishubhisham, and that cost 50 ml cost every 2 hours, Muhurum. Then Ushiraso as systemic alkalizer before food, then Sanshimanivati. Sanshimanivati as an anti-inflammatory and antipyretic drug. It's very important to know that if you use paracetamol for hyperpyrexia, and if you check the body temperature of that patient after half an hour, generally the body temperature goes subnormal. Basically, hyperpyrexia is an immune response, which is very important. Without raised body temperature, WBCs cannot multiply properly. In fact, our immune system cannot perform properly without raised body temperature. And if the body temperature is going subnormal, that means we are interfering that basic immune response, which is not good at all. Whenever we use Sanshimani, a very good quality Sanshimani, we generally use a loading dose of 2 grams. And when we give it to the patient, when we check the body temperature of that patient, obviously hyperpyrexia is very efficiently managed, but the body temperature always lies between 99 and 100. So body temperature never ever goes subnormal. Very rarely we need to use antipyretics such as Jaimangal Ras or Mahamrutyunjay Ras to address such hyperpyrexia. Otherwise, Sanshimani is very effective. So we need to believe in our own science, in our own drugs. Now the result. On admission on 15th July 18, his total count was 20,180. So he was in septicemia, as you can see in this report. Just within 4 days, without any kind of antibiotics, with only Ayurvedic treatments. In fact, if you see this, the patient was clinically stable within 24 hours with bladder wash and all this treatment. Patient was absolutely stable within 24 hours only, with biomarkers within 4 days. The count, which was 20,180, that means the patient was in typical septicemia. Within 4 days, the total count is only 6,610. So this is definitely possible in Ayurveda, in Ayurvedic Urology. So we are coming with this particular wisdom of Ayurvedic Urology. We are going to start the basic course of Ayurvedic Urology. You must have seen many patients, they keep on visiting different hospitals for recurrent UTI, and in Ayurveda we have very promising treatment for this condition, not only for recurrent UTI but for multi-drug resistant UTI as well. So in the course we are going to discuss all these subjects, all these diseases, all these conditions, and its Ayurvedic urological management step by step. So on our website, there is a tab we also treat. So there are different conditions which we treat, like benign enlargement of prostate, bladder outlet obstruction, interstitial cystitis, recurrent UTI, hypotonic bladder, neurogenic bladder, incontinence, enuresis, means bedwetting, etc. And all these conditions, obviously, they do not have promising treatment in conventional urology, but in Ayurveda, yes, we have very promising and quick treatments. To conclude, there are certain important points regarding preventive measures. Generally, whenever a patient asks to any doctor or urologist regarding the fluid or water intake, they generally mention it in terms of liters. But it's very important to know that the need of water or fluid of a person's body can never be decided by a doctor, but it is always decided by that person's body only. And the best indicator is the color of urine. The color of urine should never turn yellow or dark yellow. It should remain near to water. A pale tinge of yellow color is fine. That means straw yellow. But it should never ever turn more than that. So it's very important. Then obviously one must respect the natural urges. One should maintain the local hygiene. There should be safe sexual practices. One should avoid cold drink. One should avoid stale or leftover food. But you should avoid late nights. Avoid sleeping during day. Regular physical exercises. Some yoga is very important, like Vajrasana, Parvatiyasana, butterfly posture, Pawan Muktasana, etc. And pranayam. And yes, Vegdharan. One should always respect. So the take-home message of this presentation is, it does not matter how many resources you have, if you don't know how to use them, it will never be enough. So this is how it comes to an end. If you are able to use your knowledge properly, genuinely, precisely, then obviously the outcome is this beautiful. As I mentioned, that we are practicing in the field of Ayurvedic Urology since 22 years. We have patients from 26 countries. We have patients from each and every state of our country. And fortunately, by God's grace, with the strength of Ayurveda, with the strength of Ayurvedic Urology, most of our patients, they are leading very normal life after Ayurvedic urological treatments. Once we had a team of Japanese doctors to learn basics of Ayurveda, I was invited to Japan to deliver a lecture regarding Ayurvedic urology. Many urologists from different countries, they visited our institute to know about Ayurveda. This lady, Dr. Iko Azuma, is a urologist from Japan. She visited our institute. This guy, Dr. Gadzi Nariman from Russia, Dr. Palaniappan from Singapore, Dr. Ahmed Salah from Egypt, Dr. Benamara Takfarinasi from Algeria. All these urologists, they especially visited our institute to know regarding Ayurvedic urology, and they really appreciated the way we are working in the field. It's a matter of pride for all Ayurvedic scholars. I am honorary consultant to Honorable Governor of Gujarat, Shri Acharya Devratji, and I got the opportunity to travel with him on his private jet. And this opportunity I got only because of Ayurveda. Obviously, being the governor of a state, he has got his own medical team on which there are 40 topmost consultants of the state, and still I got the opportunity because of only Ayurveda. So Ayurveda has this potential. Just we need to realize the potential. We need to encash this opportunity. Then obviously sky is the limit. Here's a small introduction of our institute.
Welcome to Brahma Ayurveda, Gujarat's first ever multi-speciality Ayurvedic hospital with world-class standards. Founded by Doctors Juhi and Narayan Shahane. We have multiple theatres well equipped for urology, proctology, Ayurveda, and Panchakarma. For patients staying over, there are multiple beds, ranging from common to VIP, with special facilities. Guests receive excellent, healthy food and access to an on-duty doctor around the clock. Here you can receive the best of modern healthcare combined with the age-old wisdom of Ayurvedic medicine. We receive many local and international patients for highly specialized procedures such as the Uttarbasti, an effective cure for urethral strictures, performed in our Ayurvedic Urology Center, the first and only in India. Brahma Ayurveda. Follow the most authentic and updated science of life.
So thank you very much for a patient listening. And yes, we have launched our first online certificate course on Ayurvedic Urology. So you are most welcome to explore this Ayurveda's wisdom. The course is going to commence from 10th of October. There will be 15 lectures, interesting lectures. In those lectures, we are going to discuss regarding all basics, including the anatomy, in fact, clinical anatomy and physiology of this area, urinary system. Then different basic conditions, urological emergencies, regarding the management of such urological emergencies with Ayurveda. Then different diagnostic tools, management, so everything. So you all are welcome to this जिसको हम कहते हैं ज्ञान यज्ञ हम शुरू करने जा रहे हैं. इसकी शुरुआत हमें खास नवरात्रि में करनी थी, तो उसका ये पहला यज्ञ आज हमने किया है. ये सभी ज्ञान यज्ञ समर्पित है माँ सरस्वती को. यू आर मोस्ट वेलकम. थैंक यू वेरी मच and all the very best.
Thank you so much, sir, for your valuable time and support. Your insights were truly valuable. Thank you so much, sir. All the information related to online certificate course in Ayurvedic Urology will be shared in the group. You can register yourself through registration link because we have left few limited seats only, and fees will increase after 2nd October 2025. So please register as soon as possible. Thank you so much.